Hi, everyone. I'm Dr. Samantha, and welcome back to another one of our live Q&A sessions. We're here every Monday at 9 p.m. Eastern Standard Time to answer your questions that you guys have submitted onto the website on our videos. Please remember to hit the like and subscribe buttons for our video and subscribe to the channel. It really helps us out. We're on Facebook, Instagram, and Twitter for additional content. And remember, share this with your friends and family. We have a ton of exciting questions that were submitted tonight, so I am going to jump right into it. But I would like to remind you that you can go ahead and you can submit questions live into the chat. So we're going to start out tonight with blood type. So we had a question come in that said, what about O negative blood type? My midwife told me to do the injection before delivery, and I'm in my 39th week. So when you have Rh negative blood, that means you have rhesus factor negative blood. This is simply one way of measuring, determining your blood type. People are either positive or negative, and there are 4 different types: O, A, B, and AB. Now, when you have a negative blood type, if you are pregnant with a baby who has positive blood, your body can actually build up antibodies against the baby. And this can cause what's called ABO incompatibility. One of the things that can happen is your baby can develop, amongst other things, jaundice after birth. Now, one of the reasons why we give RhoGAM is to prevent this from happening. We don't want your body's immune system to react against your pregnancy because it thinks the baby is a foreign invader. Now, what I will tell you is if your healthcare provider has asked you to take the RhoGAM shot right now, even though you're 39 weeks, I would go ahead and follow their advice. This can be a life-saving medication. However, you want to ask why. Normally, we give it around 28 weeks of pregnancy. Now, after birth, they usually will test your baby's blood type. And if your baby does indeed have a positive blood type, they're going to go ahead and give you the RhoGAM shot again. It's very important if you have a negative blood type and you have, for example, a miscarriage, you should ask to receive the RhoGAM shot as well, because you want to make sure that your body does not reject any future pregnancies. And Rh incompatibility can lead to miscarriage. So it's very important that you always get the RhoGAM shot if either you are unsure of your baby's blood type or your baby has a positive blood type. Again, for this particular viewer, while 39 weeks is not the standard, for whatever reason, your healthcare provider has probably determined the benefit outweighs the risk, and I would go ahead and follow their advice. So our next question actually comes in about blood transfusions, okay? So does a blood transfusion come from someone else's blood? So this is actually a good question. So normally blood transfusions do come from another donor. So people will go into hospitals and donate blood. They'll go to blood donation centers. Oftentimes you'll find these blood bank trucks in front of different events, in front of libraries, in front of grocery stores, trying to get you to donate blood. What they do is they screen a donor for a variety of different things, and then they take the blood. The blood is then sent off to a lab and tested for different diseases. It is sanitized. Sometimes it's separated because oftentimes the blood will be separated into different types of blood products, for example, red blood cells and platelets, and then it's sent into hospitals. Now, when you receive a blood transfusion in the hospital, generally speaking, you are receiving somebody else's blood. This is because most of the time when we're getting a blood transfusion, it's considered an urgency or an emergency. Basically, you need the blood right away. It's gonna save your life. So when we get that blood, we do not have time to get it from anybody else that you might know. We need to get it done now. Sometimes we will offer the ability to a patient to donate their own blood ahead of time. This is usually done when you know you're going to be having a surgery. However, when you're pregnant, this usually doesn't occur. Now, That's called an autologous blood transfusion. If your baby needs a blood transfusion, there is sometimes enough time for you to potentially donate to your own baby. Now, again, this depends on a lot of factors, including whether your baby's life is in danger. However, a lot of our premature babies may require multiple transfusions during their hospital stay. And while the first transfusion may be an emergency and you need to use some of the blood that's on hand, future transfusions, you might be able to donate ahead of time for your baby, or possibly even for other people's babies. But generally speaking, to answer the question, yes, most of the time you are receiving someone else's blood when you get a blood transfusion. So it's a very good question. For those of you who are joining us, please feel free to put any questions you have into the chat. Now we're going to go to baby sleep. We got a couple interesting questions about baby sleep. So first question, my 3.5-month-old baby rolls well from back to tummy, but not from tummy to back. We place her on her back to sleep, but she rolls herself onto her tummy. I know it's okay for them to put themselves in that position, but is it true that at 3.5 months and without the skill to roll back over, is it okay for her to do this? She sleeps with a heart rate monitor, but I'm still nervous. So this is a great question and highlights a lot of things. So the first thing is the whole safe sleep issue. Babies should always be put back to sleep. This helps reduce the risk of SIDS, which is sudden infant death syndrome. However, babies can roll themselves over. And generally speaking, once a baby can reposition themselves, it is considered safe for them to sleep in that position. You always put them back to sleep, but like this mom says, her baby rolls over and repositions herself. Now, there is the concern always about a baby who developmentally can go one way but not the other. One of the things that you can do is you can start doing tons and tons of tummy time. Tummy time is a way to build up some of those muscles and stuff to allow for that skill. The other thing is when you're doing tummy time, you can help practice with her to roll from her stomach to her back. She probably developmentally is actually really close to this skill, but hasn't quite mastered it. Now remember, if she is able to roll to her stomach, she is also able to reposition her head. So she has an innate instinct to breathe. Okay, we all do as human beings. So the thing is, even though she may not be able to correct herself back to her back, she does have the ability to lift her neck and turn to the side. So she's not going to face plant into that mattress. Now, the other thing that prevents this and allows for her to be safe is the fact that the mattress should be firm. And it's okay to have a sheet, but there shouldn't be a fluffy blanket there. So even if she face planted and couldn't move her head, which is not the case, there'd be a little air pocket here for her to continue to breathe. She also has her arms, which should be out and available for her to use. And that's enough for her to just reposition her head to be able to sleep safely. But again, if you go ahead and you do a lot of tummy time now, like more than you have been, and you help her practice that skill, she's probably going to pick it up very, very quickly. So that was a good question. The other question we got about babies' safe sleep is, what is best for my baby, a bassinet or a crib? So this is a fantastic question, in my opinion, because this highlights how there is a ton of baby products out there that you do not need, okay? So this is the age-old question, bassinet versus crib. So a bassinet is like a smaller, more enclosed crib for basically a newborn. They grow out of this extremely quickly, okay? Like within 2 or 3 months, this baby cannot even be in there anymore. And some of our babies, it's within even a month. If you have a big baby who's very long and very heavy, they're out of that before you know it. Now, bassinets are cute. They're smaller. They can be convenient. In my opinion, they're a complete waste of money. Now, are they safe? Absolutely. So if you want to go ahead and use a bassinet for your newborn, please feel free to do it. They're absolutely safe as long as you're buying one that's in a store that's been rated for safety. However, I find that when I'm recommending stuff for my new parents, I tell them to get a pack and play. So a pack and play is a portable crib. It's kind of like a playpen, travel crib, bassinet, and sometimes even changing table all in one. Changing tables are another thing that I think are a waste of time and money. Okay. So with the pack and play, it has a smaller bassinet portion on the front. So you can go ahead and use that when your baby is small. But the nice thing and the practical thing about a pack and play is you can fold that up and take it anywhere. You can take it on a plane. You can take it into a restaurant. You can take it on the beach. Anywhere you need to go with your baby, you can take that with you. So even when the baby grows bigger and cannot use the bassinet portion anymore, you still have this travel crib that they can use into toddlerhood potentially. So in my opinion, it's better to just go ahead and do the crib. Cribs have the side rail that will come down part of the way, and most of them are designed to have the mattress rise up in the beginning, and then you lower it as your baby becomes more mobile and is able to stand and pull themselves up on their own. I think cribs make a lot more sense, and they're a lot more cost effective and a lot more logistically easy to deal with than having two different sleep things. And here's the other thing. You're very likely to have 2, maybe 3 kids. So this piece of equipment, a bassinet, which might cost a couple $100, you will use for maybe 3 or 4 months, maybe. And then basically you're giving it away and it's in brand new condition. So either one is fine. However, I would recommend the crib. But that was a great question that I'm sure a lot of people have. And there's a lot of baby gear that people just don't need. Okay, so polyhydramnios at 32 weeks, no diabetes. I'm so worried for my baby's health. Is my baby okay? Can I still go for a natural birth? AFI is 38. Oh my gosh, Dimpy, 38? You must be feeling very tired because that's a big belly that you've got. So for those people who don't know what she's talking about, polyhydramnios is extra amniotic fluid, okay? So there's a couple reasons why this can happen. One of the reasons she has mentioned is diabetes, okay? So there's oftentimes extra fluid with a mom who has diabetes when she's pregnant. Another reason for polyhydramnios is kidney issues with the baby. So I'm not sure, Dimpy, if you've had the baby looked at, but you should be asking your OBGYN to send you to a maternal fetal medicine if you have not. Now, is your baby okay? Generally speaking, babies are okay. With the exception of a kidney issue, which a lot of the kidney issues are also actually okay. They resolve after birth. Babies usually do fine. Of course, with diabetes, the babies can be large for gestational age, and this can mean that they will have trouble with their blood sugar after birth, and they may need intensive care. But the babies are usually fine with extra fluid. So, what is the likelihood of a natural birth? The nice thing is that usually you can have a natural birth. However, there is one huge risk factor with polyhydramnios that you should be aware of, and it's called a prolapsed cord. So a prolapsed cord means that the baby's umbilical cord drops down through the cervix and out through the vagina, okay? So when you have a ton of water or amniotic fluid, your baby, so you've got your uterus and this is the cervix, right? So at the end of your pregnancy, baby's head is supposed to start to really push on this cervix so that when you're having contractions, the cervix will be helped to dilate open. However, when there's a lot of fluid, babies will often float high. They don't really get down there, okay? When the water breaks, for most people with a normal or small amount of amniotic fluid, the baby's head is there. And so nothing really happens except some fluid comes down through the cervix and baby's head engages or hits the cervix more. For somebody with polyhydramnios, if the baby's head is high, this means when the water breaks, the cord can slip down in front of the baby's head and then come through the cervix. The reason why this is an issue is then the baby's head comes down. This can put pressure on that umbilical cord and it can actually pinch it completely shut. That is a medical emergency. So a cord prolapse is a medical emergency. This is not, I'm getting in the car and going to the hospital. This is you're laying flat, you're putting a pillow underneath your hips and you're calling 911. Medical emergency, do not pass go. So for a lot of women with polyhydramnios, you will actually be induced early. The reason for this is so that you can be in a hospital setting when we decide to break your water or when your water breaks. This allows you to get the emergency care you might need if a cord prolapse happens. If you are at home, what you would look for is if your water breaks and you feel something funny between your legs, or you feel pulsating between your legs, you need to lie back immediately and call 911. If you have somebody around you, you can ask them to look. You can ask them to take a picture to see what you might be seeing, but you should be calling for an ambulance. You do not want to do anything, because in the hospital, what we actually do is we will stick our fingers, sterile gloves, of course, inside, push the baby's head up, and then we have to stay there until you have a C-section. That's how serious this can be. So please understand that's your biggest risk factor. Most women, this is not going to be a problem, and they will go ahead and they will deliver normally, okay? You do have a slightly higher chance of having a preterm birth. So if you start to have contractions or you think you're in labor, you do definitely, don't think they're Braxton Hicks. Don't worry about calling your provider a million times. Just do it, okay? Because we don't want your water to break if we can help it while you're by yourself, okay? But that's a great question. Congratulations. Okay, so our protein drinks like Premier, Ensure, Boost, good to help with my wife's protein intake. She tries to get at least 75 grams per day, but she's not quite getting there. And she is only in, it says trimester, I'm going to guess the first trimester. So those drinks can be used. Honestly, the biggest risk with those protein shakes is if somebody is in kidney failure, which is not common with a woman who is pregnant. She's usually pretty young and pretty healthy. So if she needs to use one of those types of drinks to help with her protein intake, that is okay. In an ideal world, she's getting her protein from multiple sources. And I would encourage you potentially to help your wife by looking up different protein sources. So I think animal proteins are very important, although you can have a healthy pregnancy using plant-based proteins. But for somebody who's eating everything, you can get creative. Listen, if she can only tolerate ice cream and she doesn't have diabetes, give her ice cream. I tell a lot of women, when you're pregnant and you're having a craving, it's funny, we say, oh, look at the woman who wants pickles during her pregnancy. But what her body may be asking for is salt. Okay, if you don't have enough salt, you can actually become dizzy. You can have like a high heart rate. You can feel really bad. So she may not actually be craving the pickle. She may be craving the salt. We laugh about women who want ice cream, but if you think about ice cream, it's a high protein source. So what her body may be actually wanting is protein, and she craves ice cream because it tastes good. So look at some of the creative sources. Another creative source is peas, green peas. Peas actually have a lot of plant-based protein. So again, if she can't really tolerate a whole bunch of meat or dairy or cheese, she might be able to do something like eat peas. But yes, absolutely. If those shakes are what she can tolerate, that's okay. Just make sure they're those and not like you don't want to be using like the muscle milk or something like that that's used for bodybuilders. The other thing I would tell you is the Boost and the Ensure, those products are actually designed to help people gain weight, especially who are medically unstable, like elderly. So she can also boost her protein using like Pediasure, which is designed for children. So she doesn't necessarily, if those are a little bit too much, because they do have a lot of vitamins and stuff in them. So people will complain that they are very metallic tasting and different things. She could try like a Pediasure as well, and that might help. So that's a great question, because protein is so important for you to have a healthy pregnancy. And actually, since I'm talking about like diet, I got a question on my keto video, which I thought was very good. And it said, I do dirty keto. I'm 10 weeks pregnant and I don't get full with the carbs anymore. I crave meat and feel better when I eat a lot of it. I'm very scared of pregnancy diabetes. So it feels better to be safe than sorry. So the keto diet, for those of you who aren't familiar, is a low carbohydrate diet. So carbohydrates are sugars that we receive from our food. And keto is brilliant, in my opinion, because it focuses on high protein and high healthy fats and lower carbs. Dirty keto is basically taking the keto food list, eating off of that in moderation, but not doing the rest of the stuff that's involved with keto, like counting macros and all this other stuff. I think dirty keto is really good for pregnant women because if you look at the food list, generally speaking, it's whole foods that would promote a healthy pregnancy and reduce your risk of diabetes. So, for example, with dirty keto, you can eat fruit. You're just going to eat keto-friendly fruits, like, for example, the berries, raspberries, blueberries, strawberries, blackberries. These are all very healthy fruits. They're high fiber, low glycemic index. Additionally, with keto, you're going to eat stuff like whole dairy, okay? One of the biggest things in the United States and in other countries is we encourage people to drink milk, but we encourage them to drink fat-free milk. Somehow fat in milk has gotten associated with poor health and high cholesterol. But what it really is it's actually just a whole bunch of sugar. So milk in the end is water, sugar, and fat. So if you take out the fat in milk, you're left with sugar water. Instead, it's actually better to drink whole fat dairy products and whole fat cheeses because that's the healthy fat. You just do this in moderation. Now, keto often gets a bad kind of reputation because people liken it to stuff like Atkins. And in Atkins diet, people were told to eat pounds and pounds of bacon and stuff. Keto is not like that. You know, healthy fat doesn't have to be bacon. Bacon's fine, but healthy fat can include olives and olive oil, avocados, nuts. It's bigger and better than people imagine. So what I would tell you guys about your diet is that you want to ensure that you have a good amount of protein, like Michael is suggesting for his wife. You want to go ahead and have a moderate amount of fat and a small amount of carbs. But again, if your body is craving something as a pregnant woman, do not ignore that. An example of a food that's not really keto friendly is sweet potatoes. Sweet potatoes are fantastic. They have a lot of different healthy things, but they're high in carbs. But sweet potatoes, for example, are high in beta carotene. So if you're craving a sweet potato, and that's just one of the nutrients it's high in, if you're craving a sweet potato, listen to your body. You are a pregnant woman growing a human being. Go ahead and do what your body is telling you, just in moderation. Don't eat 12 sweet potatoes, and you don't have to put the brown sugar or marshmallows on it. You just eat the sweet potato with maybe a little bit of butter and some salt and pepper, okay? So those are great questions, and I think diet is so important for having a healthy pregnancy. So we have a few more questions. We're going to go ahead and we're going to answer a question about cesarean sections. So can a woman have a vaginal delivery a year after having a cesarean section delivery? So this is a very good question. So a cesarean delivery after a vaginal delivery is called a VBAC. It's vaginal birth after cesarean section. VBACs are becoming more popular because cesarean sections hold more risks for women than even a VBAC does, okay? The most important thing you need to know first is that you have to ask if your provider is going to do that because there are healthcare providers out there that will not do a VBAC. And if your healthcare provider is not going to offer that to you, then it's just a no right away. Now, you are supposed to have what's called baby spacing to have the healthiest recovery after a C-section and surgery. Baby spacing means you wait 2 years between giving birth and getting pregnant. So your baby is almost 3 years old before you actually deliver a baby. Now, that doesn't mean because you're earlier than that you cannot have a VBAC, but it means there's some higher risks because really your uterus is still healing. Now, the biggest risk from a VBAC is what's called a uterine rupture. So a uterine rupture means the uterus tears open, okay? It is a medical emergency and requires an emergency C-section, okay? So when you're going to do a VBAC, most of the time you are going to be giving birth in a hospital in case this happens, because once that happens, we need to get you and the baby, we need to get the baby out. So it is possible that you would be able to deliver completely safely, but there's no way to know without just going through it and experiencing it. Okay. Okay, I see there's another question in the chat. Is there no natural way I can resolve polyhydramnios? I remember my doctor gave me a steroid shot 2 days ago on my back. I'm on full bed rest now. Okay, so there is no way to resolve polyhydramnios normally, okay, naturally. Your baby does cycle through a little bit of that amniotic fluid. So the reason why amniotic fluid is so important for our babies is that one of the things it does, it provides that environment for your baby to live, right? But it also helps the baby practice breathing. So your baby does take in amniotic fluid, and some of it will pass through the baby's umbilical cord and out through your system. Some of it gets reabsorbed, but unfortunately, most of it just stays there, and there's no way to fix that. Now, that steroid shot, for those of you who are wondering what that might be, she got a shot of steroids probably in her leg or her backside, her bottom. That shot was to mature the baby's lungs. So that's actually really awesome, Dimpy, that they gave that to you, because that is going to help your baby's lungs develop faster. They are anticipating with you that you're going to go into preterm labor and you're going to give birth early. So your doctor is actually doing everything exactly right for you, okay? So that shot will help to mature your baby's lungs. If you stay pregnant for the next several weeks, they'll actually probably repeat that. Now, the full bed rest is because at this point in time, with that amount of fluid, you probably have a lot of pressure on your cervix, which means you're a lot more likely to go into preterm birth. So right now, the bed rest also makes sense for you to go ahead and just try to keep that baby in for as long as possible. Make sure you're drinking plenty of fluid. Fluid is one of the biggest things that can cause contractions that lead to preterm birth. Somebody might say, well, I don't think that I should be drinking fluid because I have so much fluid, right? So it's actually not true. The fluid that you take in has nothing to do with the amount of fluid your baby is producing. You are producing fluid for a completely different reason. Keeping yourself hydrated keeps you healthy, keeps your blood circulation going, and reduces your risk of going into preterm birth. So make sure you're drinking lots of fluid. There is a video here on on bed rest. So I would suggest that you watch that video if you haven't. We will tell you, Dimpy, is this is the time for you to try to relax as much as possible. If you're looking for things to do, I would tell you to go ahead and to potentially journal to your baby. That's a lot of fun. Do some last minute shopping. If you have a baby shower planned, ask your friends and family to come to you, because you're not going to be able to go somewhere else and get that baby shower done. Go ahead and just do everything you can to stay stress-free and get ready. And then, if you have any symptoms at all of labor, and we have a labor video, if you haven't checked it out, you want to go ahead and call your healthcare provider immediately. But your doctor sounds amazing. You're doing the right thing. Oh, and if you know what hospital you're delivering at, a lot of hospitals can arrange a hospital tour for you. And because of COVID-19, it used to be that the hospital tours, you could come in, you could be in a wheelchair, and you could see the place. Ask your doctor if you're allowed to do that. If you're allowed to do that, I would suggest you do that. But now, because COVID-19 shut down a lot of hospitals, the NICUs got used to doing video tours as well. So you might be able to get a video tour of the neonatal intensive care unit where your baby might be staying, so that you get an idea of what it's going to look like ahead of time, which can help reduce anxiety. So I saw your question, Michael, on COVID-19 shots. So COVID-19 shots are absolutely okay to get during pregnancy. At first, there was a lot of uncertainty about it. Pregnant women were one of the last groups to get approved for that. But what we since learned, so pregnant women are considered immunocompromised, When you are pregnant, you are growing a human being, and all of your body's resources are going into that. In addition, you have additional strain on your lungs, on your heart, and on your kidneys. So as a result, your body is not functioning at optimal level. So pregnant women are prone to all sorts of infections. And so it's really important that we try to keep you as healthy as possible. COVID-19 affects all the major organ systems. A lot of people try to liken it to the flu or something, and it's nothing like that. And I'm going to tell you that I was in the hospital working full, like when COVID-19 hit. And I can tell you that a lot of my fellow healthcare providers were also working in mother baby units during COVID-19, and we all experienced maternal death. We all had a patient that died from COVID-19. So whatever you've heard in the media, I can tell you from being at the bedside that we all saw that. And it is something that I never want a pregnant woman or their family to have to experience. Now, there are risks with any vaccine that you get. Definitely talk to your healthcare provider. Look at the different options that you have available. And the COVID-19 vaccine recommendations are changing all the time. But COVID is still here. I can tell you that I have patients today that are telling me, I have COVID now. I had COVID last week. My parents got COVID. COVID is still here. COVID is going to be here for the rest of our life. And in case you guys are wondering, because a lot of people get very concerned and they'll say, oh, but it's like the flu and the flu isn't a big deal. I have also had patients die with the flu that were pregnant. So the flu is a big deal. You are immunocompromised when you are pregnant. You are not a healthy adult walking around, even though that's how you feel. So it's very important that you take that into account when you're making your decisions about vaccinating. Now, I respect everyone's right to not get vaccinated. But what I would encourage you to do is, as a pregnant woman, if you decide that this is something you're not comfortable with, make sure you protect yourself. Don't go to big parties. Don't go out to concerts and sporting events. Don't let anybody come over who says they have allergies or a minor cold. Like, keep yourself safe. Yes, you've got to go to the grocery store. Yes, you've got to go to work. Like, I'm not telling you to quit your job and become a hermit, but make very safe decisions for yourself because it's still there. Okay. All right. I see another good question. I'm 38 weeks pregnant and I was told I will be induced next week. I'm terrified about this. Can I ignore this and wait on the birth naturally? My baby is also very big via ultrasound. Okay. So this is a fantastic question, and I can completely understand why this is very, very scary for you. So if you are being recommended for induction for a big baby, the reason for that is that they may have decided that they're concerned that the baby will not be able to be delivered vaginally if they don't get the baby out sooner. Every single week, starting at 36 weeks, your baby can gain a full pound in your belly. So if your baby's 8 pounds at 38 weeks, you could have a 9-pound baby at 39 weeks. So it depends on every woman's body whether she'll be able to deliver this big baby. But there are risks to having a natural birth with a baby that's too big. One of those can be what's called a shoulder dystocia, which is a medical emergency and often requires an emergency C-section. And so we don't want to get there. We don't want your baby to get so big that this is one of those potential risks. Now, an induction, they sometimes will have a higher risk for C-section. But most healthcare providers now aren't rushing inductions. It used to be that you had 12 hours, and if you didn't dilate, that was it. You were going for a C-section. Nowadays, a lot of inductions will actually take 4 or 5 days. So in case you didn't know this, don't expect to walk in on day 1 of your induction and have a baby 24 hours later. You might be there for 3 or 4 days before that baby even comes. Now, a couple things that I would encourage you to do. 1, ask your healthcare provider if you can start pumping. So this is one of the natural ways to induce labor. And there's actually a video that I have on that. So pumping your breast can help to stimulate oxytocin. and oxytocin can help to ripen your cervix naturally. Additionally, you might be able to collect a little bit of colostrum that you can put in your freezer and save for your baby after birth if you're having any trouble breastfeeding, if you choose to breastfeed. So this is one of the ways that you can help to soften and ripen your cervix so it's more favorable or more likely that the medications they're going to give you will help you dilate. Now, the next thing is you want to ask about the medication they're going to use because, see, there's different medications. Sorry, one second. I've been talking a lot today, so I'm losing my voice. So there's oxytocin, which is the one, or Pitocin, which we're most familiar with. And that's the one that everybody's really scary about. It's the IV solution that causes the contractions, and the contractions come together and they're stronger and stronger and closer, and it causes a lot of pain. But there's actually other medications they can use first. So if your cervix is not ready to dilate, you can actually use a medication called Cervidil. So Cervidil is this little tiny flat piece of cotton that has the medication kind of infused into it. And what they do is they take this and they slide it up next to your cervix. And the medication comes and it kind of goes into your cervix directly. And the point of Cervidil is it actually softens your cervix up and makes it squishy, so it's ready to respond to stuff like oxytocin. Because a cervix during your pregnancy should be long, thick, and high. What does that mean? So uterus, cervix. Cervix, long, thick, and I'm sorry, I say high, I meant closed. Closed. Long, thick, and closed, okay? So if this is thick, that means it's also kind of hard. It kind of feels like your fingers do. I felt cervixes. So we want to get it soft and squishy, like a soft blanket, because that means that when you use something like Pitocin, or if your contractions start to happen naturally, it's just going to slide open and baby will be ready to come out. Now, part of the reason why this can be really scary is because you're being told there might be a complication that's about to occur. And so what I would tell you is just have a lot of conversation with your healthcare provider. Ask them, what medications are you going to use? How long are you going to let me have the induction for? Am I on a time frame? You know, how long do I have once my water is broken? Are you going to break my water right away? I will tell you to advocate, if possible, not to let them break your water. Okay. If you can help it, once your water is broken, you're on a clock. After 12 hours, they need to start giving you antibiotics because you and the baby are at risk for infection. And usually after 24 hours, they have you have a C-section unless you're really, really close because the baby is at risk for infection. So ask those questions ahead of time. Check out the video and talk to your healthcare provider about induction, okay? Oh, I know. Everybody's really anxious about hospitals. So you guys aren't alone. And actually, I have a video that I put out last week that was about what an operating room looks like when you're going to have a C-section, because operating rooms are scary. If you've never been in an operating room, you have no idea what to expect. I have another video that talks about what they're going to do when you get in the hospital to get ready for your C-section, okay? Tomorrow we've got a video coming out on the different types of tests and procedures that they're going to do for your baby, okay? So when you're having your baby after birth, they're going to do different blood tests and different screenings. And if you don't know what they are or why they're doing them, it can be scary. The nice thing is, if you say the words, "I'm scared, can you explain this to me?" Healthcare providers, especially in the labor and delivery, mother, baby, and neonatal intensive care unit arena, we are good. We're ready to go because we don't ever want to overwhelm you. So if you don't ask us what that beeping is, we're not necessarily going to tell you because it might be scary to hear that. So if you ask, we'll respond. And let me just tell you one thing that I think every nurse should tell a mom who's in labor, and they never do. When you get in, they put the monitor on your belly to listen to your baby's heart. And so you're hearing your baby's heart, but for the first time, you're hearing it for a long period of time. And then on top of it, there's this piece of paper that's spitting out what your baby's heart rate looks like. And it looks like this all over the place. That is, generally speaking, normal. Okay, most parents, they get freaked out. They're calling you up. They're like, oh my God, the baby's heart rate was this, and now it's this, and now it's this, and now it's this. Generally speaking, we actually like that. That's considered a baby who's nice and healthy. And so we're good with that. If there is an issue, we will tell you. Okay. But my biggest suggestion is don't stare at the monitors. They make it worse. Okay. They make it worse for you. For those of you who are joining us, please feel free to put questions into the chat. I'm Dr. Samantha, the maternity mentor, and I'm going to go back to some of our other questions because we had a lot of great questions this week. So, cord blood banking. If I bank my cord blood and tissue, is there only enough for one treatment or is there enough for several treatments? I know this depends on what we are treating for, but I'm trying to figure out if it's banked for a one-time shot or if it gives us multiple options. So this is a great question. Cord blood banking are companies that what their job is they collect your baby's cord blood and tissue after birth and they store it, they cryo freeze it in their facility, and you pay a monthly storage fee to basically house that material. Why do people do that? People do that because you can use those cord blood stem cells for other things. For example, cord blood stem cells can be used to treat childhood leukemia. Okay, that's one example. So cord blood banking is cord blood stem cells have also been used for kids with cerebral palsy and other types of paralysis. There's a lot of different things we can use it for. Now, there's a couple, this question is actually interesting and it highlights one thing. So you know, it is not guaranteed that you will be able to collect cord blood after birth. I cannot tell you how many times I have been in a delivery and we cannot collect cord blood. So the first thing is we do delayed cord clamping. So this is a technique where we actually want to go ahead and allow as much of that blood to go into the baby before we clamp and cut the cord. This has been shown to reduce the risk of anemia, especially in preterm babies, and it gives them more blood volume and it's way better for the baby. So now we go ahead and we basically try to get as much of that blood into the baby to begin with. Once that's done, getting a piece of tissue is usually easy. The question becomes, is there enough cord blood to collect? If you can collect a fair amount of cord blood, it then depends on the treatment that's being done. You know, if they just need a few stem cells, and nowadays a lot of times they can go ahead and they can reproduce those stem cells, you know, they would go ahead and be able to get more than one treatment. But a lot of times need all of the cord blood they have for just one treatment at a time. Because the other issue is they're going to unfreeze that sample in order for it to be used. And really, unfreezing and freezing is not a good idea. Now, what you could ask the cord blood banking company is, can they go ahead and freeze it into multiple vials? That might be a way for you to be able to use it for more than one thing. However, that may cost more than one storage price. Okay. Hi, Shoshana. Okay. So is it normal to get headaches every day? I'm 25 weeks. No, it's not normal. Okay. Now, the first thing that anybody in this field says, if you're getting headaches every day, is what is your blood pressure? Okay. So headaches can be a sign of preeclampsia, and preeclampsia can occur as early as 25 weeks. So preeclampsia is a condition that involves multiple things in the body, but it's usually characterized by high blood pressure early in the pregnancy. Now, some of the other symptoms of preeclampsia include visual disturbance. So visual disturbance can be anything that's weird visually. So it can be that you get spots in front of your eyes. You can see light flashes. You can see like a narrowing of your vision. It can look cloudy. Anything, any changes in your vision, or it can look blurry, anything, that is considered a visual change. The other part of preeclampsia is usually pain in the upper right quadrant of your stomach. So right below your breast, right there by your ribs, okay? Now, some women will like mistake this for heartburn. This is not heartburn. This is something that you do not want to ignore, especially if you're getting headaches, okay? You want to take these 3 things and look at it, and it's considered the trio of symptoms for preeclampsia. And we have a video that we're going to link in the description. So what can you do? So the first thing is you want to start taking your blood pressure and you want to call your healthcare provider. You want to figure out what's going on. Now, could there be other causes of headaches every day? Absolutely. So for starters, you're putting, when you have a big belly, if your belly's big, you've got a lot of weight in the front of your body. That's causing a lot of strain on your spine. So that strain on your spine over time could be causing your spine to be misaligned and actually be pinching on a nerve, especially if you have like already a history of a bulging disc or something. This is why a lot of women do pregnancy chiropractic care. Like they get chiropractic treatments, okay? So that could be what's going on. And as your pregnancy progresses, there's a hormone called relaxin that gets released to help like calm, like soften all of your joints, because it's trying to allow your pelvis to kind of open up to allow for a vaginal birth. So it could be something like that that's going on, and a pinched nerve could cause headaches every day. You could also be getting headaches because you're not sleeping well. You could be getting headaches because your blood sugar is dropping, okay? So if you notice that you're getting headaches every day, say 1 hour before lunch, maybe your blood sugar is really, really low, and that's what's causing it. So what you need to do is you need to contact your healthcare provider and let them know what's going on and see how they want to proceed. But they should be checking you. And the biggest thing they're going to be looking for is preeclampsia. They're going to check your urine, see if there's any protein in your urine. So preeclampsia affects the kidneys, and one of the ways we figure that out is there will be protein that starts to appear in the urine. Protein in your urine is abnormal, and it's a big warning sign of preeclampsia. So if they're seeing any other symptoms, they're going to start to monitor you more carefully, and they're going to send you to a maternal fetal medicine specialist. It's a great question. We have a question on depression. Anybody take Cymbalta or duloxetine? I can't get off mine, but I would love to have kids. So many of you know I'm a psychiatric nurse practitioner. That's one of the things I went into this because as a lactation consultant, I saw a lot of moms, both pregnant and breastfeeding, that were having trouble being treated for depression and anxiety and other things. And I felt, it was important to be able to advocate for them. So Cymbalta or duloxetine, Cymbalta's brand, duloxetine is generic, is an SNRI, which is a serotonin norepinephrine reuptake inhibitor. Okay, so it boosts serotonin and norepinephrine, which are 2 of the brain neurotransmitters that affect your mood and other things. Cymbalta is newer. It has a cousin called Effexor. Effexor is an older SNRI. So because Cymbalta is newer, we don't have a lot of data on it, okay? We cannot do studies on pregnant women and breastfeeding women. It's not ethical because you could be giving somebody something that could hurt their baby. So we have to go with anecdotal evidence. So right now, there's not a lot of evidence to tell us whether Cymbalta is safe or not. However, Cymbalta's cousin Effexor is okay for use when benefits outweigh risks. So we assume that Cymbalta is safe for pregnancy. Now, that being said, one of the things I would tell you is if you're having trouble getting off your Cymbalta and it's something that you really want to do prior to conception, I would try to find a provider who can help you with that because it is actually possible. So if you go onto Postpartum Support International, you can find providers like myself who've been trained to help women because we've received specialized medication training, okay? So for example, one of the things they might be able to do is actually transition you from your Cymbalta to its cousin Effexor, okay? And then the Effexor has a lot more options for tapering you off. Now, ultimately, it is safer for you to be medically treated for your depression and anxiety while pregnant than to be left in crisis while pregnant. Because when you're in crisis, you release a whole bunch of stress hormones that can actually cause miscarriage, preterm birth, and stillbirth, okay? It can also lead to a baby who has trouble regulating their temperature, a baby who has trouble regulating their sugar, and a baby who's low birth weight. Which leads into another question we got, which was, I'm in my 18th week of pregnancy and having second thoughts about the SSRI. Should I go ahead with it? Will affect my baby long term. So there are a lot of SSRIs out there that are being used. So SSRI is a medicine that increases serotonin, and it treats usually anxiety, depression, and some panic and other things. Okay. So the SSRIs that are common in pregnancy: Prozac, Zoloft, Celexa, Lexapro. Those are the most common. Okay. So if you're starting to have increased anxiety or depression in the middle of your pregnancy, again, left untreated, this can lead to a risk of preterm birth, miscarriage, small for gestational age baby. So it is important to treat your mood if it is getting bad, okay? The most evidence-based treatment starts with therapy, but if medication is needed, it is needed, and the SSRIs are considered safe. However, there is a risk of a withdrawal syndrome at the end when you give birth. So withdrawal syndrome sounds, oh my God, crazy scary. It's actually not too bad. So when the baby does get a little bit of that medication through the placenta. So when the baby is born, the baby no longer has that medication being delivered to it. So the baby withdraws. It feels the effect of not having that extra serotonin. So what does it look like? The baby's more irritable, may cry more, may have a little bit of trouble feeding. What do? You hold the baby a lot. You give the baby a lot of skin to skin. You be patient, and you try to offer the baby as much food as the baby wants. Now, how long does it last? 5 to 10 days. But there are strategies to work around that. For example, a lot of women that I start medication for first, second trimester, when we get into the third trimester, let's say they're on 50 milligrams of Zoloft. We might decide right at the very end of their pregnancy, if they're stable, to drop their Zoloft a little bit so the baby gets a little bit less of that serotonin. So when the baby's born and she increases her Zoloft back to her regular dose, when she's breastfeeding, the baby gets a little bit more in the breast milk and is able to wean off naturally that way. Okay. So there's lots of different strategies that you can use, but really withdrawal syndrome is not terrible. If you know what to expect, you can have the patience to deal with it. And then if you are healthier and happier, it reduces your risk of like postpartum depression and anxiety, which is also bad for your baby. Because if you're not feeling good, you're less likely to breastfeed, you're less likely to interact with your baby. It's just not a good situation. Thank you so much. Okay. So when you went to the hospital and the nurse checked you and felt the baby's head, the cervix was soft. However, I'm severely dehydrated and I went through 7 bags of IV fluid. Oh my gosh, that is a lot of fluid. So yeah, that's a very big deal. And I want to make sure that you go ahead and you drink lots of fluid. And those ketones, that's not a good sign either for your kidneys. I can see that. Just keep drinking a lot of fluid, okay? So high blood pressure, since I just answered that question about the headaches. If my blood pressure only goes high in the hospital, but at home it's in normal range, should I take my blood pressure medication? Yes, you should take your blood pressure medication. If you have been given blood pressure medication, you take it. So, blood pressure that's high in front of doctors or in offices or in the hospital is sometimes considered white coat syndrome. Basically, this means you get anxious around doctors and you go ahead and you get a higher blood pressure. Okay. But here's the thing. If you're taking a blood pressure medication and you're taking it and your blood pressure is normal at home, that's probably because the blood pressure medication is making your blood pressure normal. And if you didn't take it for long enough, your blood pressure would actually get too high and that could be a problem. So when the blood pressure is too high, it affects the placenta. The placenta is the organ that feeds your baby through the umbilical cord. So it's an organ that sits on the side of your uterus. It's got all sorts of blood vessels here that hook to your blood vessels, and that's where we transfer nutrients and toxins, right? When you have high blood pressure, those blood vessels start to die. That's basically the easiest way to say it. So one by one, they start collapsing and dying. And your baby starts to get less and less blood. So as the pregnancy goes on, the umbilical cord gets smaller baby doesn't get as much as it needs. And then because there's less blood going through, it's harder for the placenta to function properly. This can lead to a baby who is small for gestational age. And eventually, if left untreated, this can actually lead to stillbirth. So when you've been diagnosed with blood pressure, it is high blood pressure. It is essential that we keep that treated. Absolutely essential, okay? Now, it depends on what medication that you're taking, why you might have a normal response at home and a higher blood pressure when you're around doctors. It just depends. It depends on if you're in extended release, which category you're in, etc. You're welcome, Shoshana. What I will tell you is if you are not sure, you want to talk to your healthcare provider and ask them how we can bridge that gap. Ask them what is the decision making that led them there. So one example that I would tell you is, let's say you have that normal blood pressure at home and you have high blood pressure in front of a doctor. Well, okay, is it white coat? Is it not? Well, if you have protein in your urine, I'm going to tell you 100% are on the road to preeclampsia, and I would take that blood pressure medication because that could help keep you pregnant for a couple weeks longer. If you are having headaches, even though your blood pressure is normal, that could still mean your blood pressure is high when you're not checking it. So there's a lot of different factors here. So again, if you're not sure, this requires a conversation. And if it's your regular OBGYN that's prescribing it to you, I would ask to be seen by a maternal fetal medicine doctor. So maternal fetal medicine doctors are the doctors that specialize in anything that's going wrong with a pregnancy. So this can include, all the complications with you, like diabetes, like high blood pressure, complications with baby, like any birth defects or genetic conditions. That's what they're there for. They specialize in taking care of anything that's not the normal standard pregnancy. And they're the ones who can absolutely guide this care and answer all of your questions. So I would absolutely make sure you're taking it. We're getting close to the end. I do have several more good questions. If you guys have anything, please feel free to put them in. I do want to try to get a couple more in, so I may go over. Our next question that actually came in was about thyroid. So I'm 21 weeks pregnant, and my TSH level is 7.1. Is it affecting my baby's brain and development? So TSH is thyroid stimulating hormone. So thyroid stimulating hormone's job is to tell your thyroid, which is right here, to make more hormone. So if it's high, that means there's not enough thyroid hormone and it's trying to say, make it, make it, make it. That is a condition called hypothyroidism. Hypothyroidism affects like every system in your body, like your heart, your brain, your lungs, everything. And if it's left untreated, it can lead to medical conditions. And so, yes, untreated thyroid conditions can affect your baby's development. Thyroid is one of the most essential things that you need to keep with good health in your body. And there are no real natural ways to treat it. Okay? It is very common to develop this during pregnancy and should be treated. If it is not treated, your baby can have medical complications after birth that can lead to them needing to have intensive care in an intensive care unit and actually need to stay in the hospital for many days or even weeks. So you want to go ahead and get this treated and taken care of. When you develop a thyroid problem during your pregnancy, unfortunately, they're going to need to take your blood a lot. And they're probably going to be changing your dose sometimes weekly. So a lot of women, when they start to have their medication changed so regularly, they think the doctors don't know what they're doing. So they're very confused by this. Every day that you get bigger and gain more weight, you probably will need more medication. So this is why they're testing you a lot and changing your medication a lot. Additionally, thyroid hormone, it's very sensitive and it can be affected by a billion things. So sometimes they get you to a good level and then all of a sudden you've got too much and they need to bring you down. So understand, as frustrating as it is completely normal if they're testing you often and changing your medication often. This is actually a sign that you're getting pretty good care. And you can ask them to explain the levels to you and why they're changing it. And finally, this should be done either by an endocrinologist who specializes in pregnancy or by a maternal fetal medicine doctor. This should not be handled by your regular OBGYN. When you deliver, you need to keep having your thyroid checked. Some women will return to baseline and never need thyroid replacement again, but other women will develop a lifelong thyroid condition that will need to continue to be treated. So that's a very good question. So we had another question about sex in pregnancy. I had sex 14 months ago, just one time, and 9 days after ovulation and 1 week before my period, that made me pregnant this year. I had normal periods after my sexual intercourse, but now for 1 month, my period is delayed. Can no sexual intercourse in the last 14 months make me pregnant? So I always like to answer these questions because for some of us, we may decide that we may think that we know the answer to this, or everybody should know the answer to this, but a lot of people don't. So the answer is no, you should not be able to get pregnant if you have not had intercourse in the last 14 months. However, I'm going to put a kind of caveat on that. So a lot of people think that as long as a man doesn't ejaculate inside a vagina, a woman can't get pregnant. They think that as long as you pull out or use a condom at the end, you can go in as much as you want in the beginning part and you won't get pregnant. That is not true. So there is semen coming out of a man's penis almost from the moment it enters. That's called, in common man's terms, it's called pre-cum, but it's basically semen coming out throughout the time. And one semen is all it, or one sperm cell is all it takes to get you pregnant. So I have seen multiple patients get pregnant using the pull-out method. It does not work. You can get pregnant that way. So going along this, guys, if you are potentially, for example, helping your partner using your hands, okay? And you stimulate them and you get some sperm on your hand and you touch your vagina without washing your hand, you can get sperm that will travel up and you will get pregnant. So I need you to understand that as outlandish or crazy as this question might sound to a lot of people, you never just want to dismiss it, okay? You never just want to say that it's not possible because there's a lot of things that are possible. But generally speaking, no, you cannot get pregnant that way. And if you are having signs that seem like you're pregnant and you're not, you need to go ahead and actually go to your doctor's office because there might be something else going on, okay? Again, we're finishing up. So we had a morning sickness question that came in. My wife is in the hospital right now with morning sickness. She cannot eat hardly anything. She can't keep water down. They have her on IV. She had morning sickness in her previous pregnancy, but unfortunately lost the baby about 2 weeks after. And after she started to feel a bit better. I'm hoping things work out better this time. I'm sure this is the last time we're going to try. Seems like a nightmare. So I am really sorry to hear this. And I think morning sickness is something that we take for granted. For those families who experience hyperemesis gravidarum, and we have a video on it, you can understand how traumatizing it is. I personally had a hyperemesis gravidarum with both of my pregnancies. My first pregnancy, I lost like, I don't know, it was like 25 pounds. I got into my 28th, 29th week before I stopped vomiting. I was in the hospital once. When I had my son, I threw up every single day of my pregnancy all the way to the end. I lost like 35 pounds. I never gained an ounce, not 1 ounce during the entire pregnancy. I went into preterm labor from vomiting 8 times at my 32 weeks, approximately. And I thought I was going to deliver, and I ended up in a hospital, and they gave me magnesium and other things. Okay. So hyperemesis gravidarum is a real thing. It is a very serious medical condition. And there are women who develop PTSD, post-traumatic stress disorder, from having PTSD. I still can't eat certain foods because of my hyperemesis gravidarum without thinking about it. Okay. So one of the things that you're want to take into account with this is that it can cause preterm labor. So what can you do? You just have to try. Every time you think you're getting dehydrated, you have to go to the doctor. You can go ahead and you can try to use every single remedy under the sun, and there are remedies. One of the best medications is diclegis. Diclegis is actually just Unisom and vitamin B6 put together. So a lot of OBGYNs will tell you to go get those two things and use them. One of the other things you can do nowadays is you can use Zofran, and there's even Zofran pumps, which is a little pump that constantly infuses it into your system to try to keep you from vomiting. One of the things I did was I took a sip or I took a bite, and then I would just stop and I would just say, just 10 minutes. I just need to get through 10 minutes. If I can get through 10 minutes, some of it gets absorbed. Some of it gets absorbed. And if you have to go sip by sip, bite by bite, that's what you do. Try to make every bite count. Try to make every bite and every sip as nutritionally well-rounded as possible. So sipping Gatorade so you get electrolytes and stuff, drinking a little bit of Boost like we talked about earlier, like whatever you can, you want to go ahead and you want to just get through it as best as you can. So I'm almost done. I'm finishing up. And I have every week a couple questions about bleeding. And so one of the things that I want to say is that there's a lot of reasons why you might bleed early in your pregnancy. Okay. It's very scary. And we get very, very worried about it. However, you can bleed because of implantation bleeding, which will happen when the fetus actually implants into the uterus. You can also bleed because you're having regular periods. Some women will continue to have regular periods for a little while after they get pregnant, and that's considered normal. Some women will bleed because of a subchorionic hemorrhage. We have a video on that. We can link that in the description. And of course, some women will bleed because they're having a miscarriage. The bottom line with bleeding is if you see that you're bleeding, you want to contact your healthcare provider immediately. You need to let them know. There's pink, red, and brown. Brown is old blood, but you still want to let them know what's going on so they can assess the situation. Also, if you were bleeding and it changes, let's say you get diagnosed with a subchorionic hemorrhage, it starts to resolve, your bleeding goes from red to brown, and then all of a sudden it's red again. Do not assume it's a subchorionic hemorrhage and ignore it. You need to tell your healthcare provider. They are there to answer your questions 24 hours a day, 7 days a week. Okay? But what you want to do is follow their advice to the best of your ability and understand that not every time is bleeding an emergency. We oftentimes get questions about labor and delivery and what are the signs of labor. There is the labor video, but a big thing that happens is a lot of people feel cramps and they feel pressure and they feel pain, but they don't want to look stupid by going to the hospital. Go to the hospital or call your doctor, okay? I have taken care of women that had no pain, showed up, just a little tiny backache, and they were 10 centimeters and ready to deliver. Everybody is different on how they feel their labor. For example, our mom earlier with all the amniotic fluid, she may have contractions that she doesn't feel because she's got all this amniotic fluid. Okay. The bigger your belly, the harder it is for you to feel a contraction. Now, if you have a low pain tolerance, you could feel something that's nothing and be in excruciating pain. Round ligament pain can feel like different things. But the thing is if you're not sure you need to get checked out, we can't see what's going on without checking you. So don't feel silly or stupid to call or show up to be assessed. That's what we're here for. And it's better to be safe than sorry. I'm going to be wrapping up here. If there's any last minute questions, put them in now because I'm about to say goodbye. My name is Dr. Samantha. I am the maternity mentor. I spent 13 years in the mother, baby, labor, delivery arena. I've been a lactation consultant for over a decade. I feel very strongly in helping you guys out. So please, please, please subscribe to the channel. It really helps me out. Hit the like buttons, set up your notifications so you can get our latest content. We have some additional stuff on Facebook, Instagram, and Twitter. Share this channel with your friends and family. And remember, we are starting to be here live every Monday at 9 p.m. Eastern Standard Time to answer your questions live. If you want to find out something, I'm going to do the best that I can to answer them. And if we don't get to them, we will try to get to them next week. And we also answer the questions that you've submitted on your videos. And without further ado, Michael Jordan, you get the last question, and this is a great one. Are those belly belts or supporters worth using? Absolutely, yes, 100%. When you are pregnant with that big giant belly, when you use those back braces, it helps pull the belly up just a little bit, which reduces the stress on the back. And that can be a lifesaver for a mom who's struggling with a lot of back and hip pain. It can actually help with some of that hip pain. Okay, you do want to ask the healthcare provider just to make sure there's not some weird contraindication for why you wouldn't want to use that. The only thing I could think of right now is like possibly if she had like an umbilical hernia or something, but that's very rare. So just ask to be sure. The other thing is after birth, especially if you have a cesarean section, that can also help with recovery pain, because after a C-section, you've got that low incision, and those help to actually pull the rest of the belly up because you still have a belly even after you give birth for a little while. And that can help to actually reduce pain. A lot of people think because it's so tight that it wouldn't be comfortable. It's actually, honestly, it's usually amazing. Most moms love them. So I would absolutely encourage you to get one of those. Okay. Thank you so much for joining us. I'm going to say goodbye for now. Please join us next week. We love you so much. We really appreciate you. Bye for now. I'm Dr. Samantha, the maternity mentor.